What is the compression depth for adults? A. 1 inch. B. 1.5 inches. C. 2 inches. D. 3 inches. Answer, C. For adult victims, compression should be at least 2 inches 5 centimeters but not more than 2.4 inches. This ensures effective blood flow without causing excessive injury. Shallow compressions reduce cardiac output, while overly deep compressions increase the risk of rib fractures. Compression to ventilation ratio for single rescuer adult CPR? A. 15:2. B. 30:2. C. 20:2. D. 10:2. Answer, B. A single rescuer must maintain a 30:2 ratio to ensure adequate oxygen delivery while minimizing interruptions in compressions. Team CPR allows better distribution of tasks, but in solo rescues, the standard remains 30 compressions followed by 2 breaths. First step if you find a collapsed victim? A. Check pulse. B. Start compressions. C. Ensure scene safety. D. Open airway. Answer, C. Safety of rescuer and victim is always the priority. After confirming scene safety, check responsiveness, then pulse and breathing. Skipping safety checks puts both rescuer and victim at risk in dangerous environments. Rate of chest compressions per minute? A. 60 to 80. B. 80 to 100. C. 100 to 120. D. 140 to 160. Answer, C. The correct rate is 100 to 120 per minute. A rate slower than 100 reduces perfusion, while faster than 120 compromises full chest recoil and effective blood circulation. Pulse check site in infants? A. Radial artery. B. Brachial artery. C. Carotid artery. D. Femoral artery. Answer, B. In infants, the brachial artery is easiest to palpate due to small anatomy. Carotid checks are difficult in small children, and radial pulses are often too weak in cardiac arrest situations. When should rescuers switch during two-person CPR? A. Every 30 compressions. B. Every 2 breaths. C. Every 2 minutes. D. Every 10 minutes. Answer, C. Switching every 2 minutes prevents rescuer fatigue and ensures high-quality compressions. Compressions deteriorate rapidly with fatigue, reducing cardiac output and patient survival chances. Rescue breathing rate for adults with pulse but no breathing? A. 1 breath every 3 seconds. B. 1 breath every 5 to 6 seconds. C. 1 breath every 8 to 10 seconds. D. 2 breaths every 15 seconds. Answer, B. For adults, give 1 breath every 5 to 6 seconds, about 10 to 12 breaths per minute. Too frequent breaths risk gastric inflation and reduced venous return, while too slow causes hypoxia. When to use AED on a child under 8 years old? A. Never. B. Only with pediatric pads. C. Immediately with adult pads if pediatric pads unavailable. D. After 5 minutes of CPR. Answer, C. AED use is safe in children under 8. If pediatric pads are not available, adult pads can be used, ensuring they do not overlap. Delaying shocks reduces survival rates dramatically. Main reason for allowing full chest recoil? A. Prevents rib fractures. B. Increases coronary perfusion. C. Allows rescuer rest. D. Avoids gastric inflation. Answer, B. Full chest recoil restores negative intrathoracic pressure, enabling venous return and coronary perfusion. Incomplete recoil decreases blood circulation and reduces CPR effectiveness. What is the preferred compression method for two-rescuer infant CPR? A. 2 fingers. B. 1 hand. C. 2 thumb encircling hands. D. Heel of hand. Answer, C. The 2 thumb encircling technique allows stronger compressions with better depth and control. It also helps maintain full recoil and consistent force compared to two-finger technique used in single rescuer situations. Adult chest compression depth? A. 3 cm. B. 5 to 6 cm. C. 7 to 8 cm. D. 4 cm. Answer, B. For adults, compression should be at least 5 cm but not more than 6 cm to avoid internal injury. Rate of chest compressions per minute? A. 80 to 100. B. 100 to 120. C. 60 to 80. D. 130 to 150. Answer, B. AHA guidelines recommend 100 to 120 compressions per minute for effective circulation. Compression to breath ratio for adults, no advanced airway? A. 15:2. B. 30:2. C. 20:2. D. 10:1. Answer, B. The standard ratio is 30 compressions to 2 breaths for adult CPR without advanced airway. First step if you find an unresponsive person? A. Start compressions. B. Check safety. C. Call family. D. Get an AED. Answer, B. Always ensure the scene is safe before approaching to protect yourself and the victim. How often to change rescuers during CPR? A. Every 1 minute. B. Every 2 minutes. C. Every 5 minutes. D. Every 10 minutes. Answer, B. Switching every 2 minutes prevents fatigue and ensures high-quality compressions. AED advises shock. What should you do first? A. Continue compressions. B. Clear the victim. C. Give breaths. D. Remove pads. Answer, B. No one should touch the patient during shock delivery to avoid injury. Where to check pulse in an adult? A. Brachial. B. Radial. C. Carotid. D. Femoral. Answer, C. Carotid pulse is most reliable and easily accessible in adults during CPR. Infant compression depth? A. 2 cm. B. 4 cm. C. 5 cm. D. 8 cm. Answer, B. About 4 cm 1.5 inches or 1/3 the chest depth is correct for infants. For 2 rescuer infant CPR, ratio is? A. 30:2. B. 20:2. C. 15:2. D. 10:1. Answer, C. In infants with 2 rescuers, ratio is 15 compressions to 2 breaths. Breathing rate with advanced airway? A. Every 3 seconds. B. Every 5 to 6 seconds. C. Every 8 seconds. D. Every 10 seconds. Answer, B. Provide 1 breath every 5 to 6 seconds without pausing compressions. Best location for AED pads on adult? A. Both on chest center. B. Upper right chest and lower left side. C. Both on left chest. D. Both on back. Answer, B. Pads are placed upper right chest and lower left side for best current flow. Pulse check should not exceed? A. 5 seconds. B. 10 seconds. C. 15 seconds. D. 20 seconds. Answer, B. Limit pulse check to 10 seconds. If no pulse, start compressions immediately. If a victim has pulse but not breathing, provide breaths every? A. 2 seconds. B. 5 to 6 seconds. C. 10 seconds. D. 15 seconds. Answer, B. Give 1 breath every 5 to 6 seconds for adults with pulse but no breathing. First action after AED arrives? A. Shock immediately. B. Turn it on. C. Remove clothing. D. Resume compressions. Answer, B. Always turn on AED first to follow its prompts. What is the universal compression hand placement in adults? A. Lower half of sternum. B. Upper sternum. C. Left chest side. D. Rib cage. Answer, A. Compressions are given on the lower half of the sternum, not the ribs. Best way to open airway in trauma patient? A. Head tilt, chin lift. B. Jaw thrust. C. Neck tilt. D. Mouth lift. Answer, B. Jaw thrust is safest in trauma to avoid spinal injury. When to stop CPR? A. After 10 minutes. B. When victim moves or breathes. C. When tired. D. When family asks. Answer, B. Stop only if signs of life return, rescuer exhausted, or advanced help takes over. Recommended chest recoil is? A. Partial. B. Full. C. Minimal. D. None. Answer, B. Allow full chest recoil after each compression for effective blood return. Where to check pulse in infant? A. Carotid. B. Radial. C. Brachial. D. Femoral. Answer, C. Brachial pulse is most reliable in infants. When should compressions be resumed after shock? A. Immediately. B. After pulse check. C. After 2 minutes. D. After AED restarts. Answer, A. Resume compressions immediately after shock without delay. Child compression depth? A. 2 centimeters. B. 4 centimeters. C. 5 centimeters. D. 8 centimeters. Answer, C. Child compression should be about 5 centimeters or 1/3 chest depth. If choking victim becomes unresponsive, what next? A. Heimlich. B. Call help and start CPR. C. Give water. D. Lay them down only. Answer, B. Begin CPR immediately and check airway for obstruction each cycle. What is the first link in the chain of survival? A. Defibrillation. B. Early CPR. C. Recognition and activation. D. Post-care. Answer, C. Recognizing cardiac arrest and activating EMS is the first link. Compression to breath ratio for children, single rescuer? A. 15:2. B. 30:2. C. 20:2. D. 10:1. Answer, B. Same as adults, 30 compressions to 2 breaths for single rescuer. What should you do if victim is breathing but unconscious? A. Start CPR. B. Place in recovery position. C. Call family. D. Give water. Answer, B. Recovery position keeps airway open and prevents aspiration. Maximum interruption during CPR should be? A. 5 seconds. B. 10 seconds. C. 15 seconds. D. 20 seconds. Answer, B. Minimize interruptions, keep pauses under 10 seconds. Infant ventilation volume should be? A. Large breaths. B. Gentle puffs. C. Deep breaths. D. No breaths. Answer, B. Only small puffs are needed to see chest rise in infants. Adult hand position during compressions? A. 1 hand. B. 2 hands, heel on sternum. C. Fists on chest. D. Fingers only. Answer, B. Use 2 hands with heel placed on sternum for effective force. If AED pads don't fit on infant chest, place where? A. Both on front. B. 1 on chest, 1 on back. C. Both on side. D. Both on stomach. Answer, B. If pads overlap, use front and back placement for infants. Compression to breath ratio for infants with 2 rescuers? A. 30:2. B. 20:2. C. 15:2. D. 10:1. Answer, C. The correct ratio is 15 compressions to 2 breaths in 2 rescuer infant CPR.